Hi, hello. My name is Hashir Aazh, and thank you very much for inviting me to this event. And thank you very much to Tanit for asking me to do this presentation. It is a great pleasure for me to actually prepare this talk for you about hyperacusis, which is a topic that interests me a lot for both in terms of clinical practice. I every day see patients who have different degrees and types of hyperacusis across the age range. I see patients as young as 5 to 6 years old who have problem tolerating certain loud noises, whether it is in school or playground, or it is at home, or if they go to a fun fair or a cinema or a shopping center, the experience can be very difficult for them. I have patients who avoid to go to public toilets in the fear that somebody might use the noisy hand dryers, and that will hurt their ears. So it can be very difficult. These were examples of children who have hyperacusis, but also adults with hyperacusis. I see patients who find it very hard to actually leave their house because of the noises that they have to put up with. I have people who constantly use ear protection, even in their own home, to avoid hearing certain sounds which seems to be very loud to them, but other people can tolerate it very well. And this impacts on their work. They can't go to their workplace or get very distracted when they're at their work. It impacts on their learning, on their relationships with members of family and friends, socializing, recreational activities, and basically their quality of life will be affected because of their intolerance to sound or hyperacusis. I also am interested in hyperacusis in terms of research. I follow very closely and the latest research that is on that people are carrying out in anywhere in the world. And so I read the articles published by colleagues, audiology colleagues, scientist colleagues, psychology colleagues, and I read them with great interest. And also I do my own research on hyperacusis and assessment and management of hyperacusis. That's the main areas that I like to focus on in terms of my hyperacusis research. And today, the presentation that Tanit asked me to give for this event is working on talking about severe type of hyperacusis. So what I'm going to do, and the plan is to first talk about the definition of hyperacusis and how I understand this. And I'll give you a bit of a background information about the audiological test for hyperacusis, namely uncomfortable loudness levels. And then I move on talking about the characteristics of people with hyperacusis and the relationship between uncomfortable loudness levels. And we try to narrow it down to get to the more severe cases of hyperacusis, and then make a comparison between the characteristics of people with more severe types of hyperacusis to those with less severe types of hyperacusis. So I hope you enjoy this presentation, and hopefully I can do this, finish this on time. So I'm going to share my screen with you to start the presentation. So yes, as I said, the topic of this presentation is severe hyperacusis and patients who find the sound level of a whisper uncomfortably loud. I'll talk about this, give more explanation when we get into the actual article, the research findings. So what is hyperacusis? In a definition that we offered in our 2016 paper published in the International Journal of Audiology, we defined hyperacusis as intolerance of everyday sounds that causes significant distress and impairment in social, occupational, recreational, and other day-to-day activities. So in this definition, simply being sensitive to certain type of sound without it impacting on your life and causing a significant distress did not really qualify as hyperacusis. And then more recently, we offered a more new definition, which is based on the first one, but is a little bit give a bit of more details. And so hyperacusis, this is the newer definition. Hyperacusis can be defined as intolerance of certain everyday sound, which are perceived as too loud or uncomfortable, and which cause significant distress and impairment in the individual's day-to-day activities. We try to make an attempt to bring the actual loudness perception into the definition, so it can be a bit more easier to distinguish people who may be distressed by certain everyday sounds, but it is not because of the loudness, it is because of other things like the annoyance that those sounds cause, or the fear that they may have about those particular sounds, which are, all of these are under this umbrella of sound intolerance problem, but hyperacusis is, at least this definition that we talked about here, is about the loudness of the sounds. So the people are feeling that the sounds are louder than normal, and it does create a stress. They feel distressed by it, and it impacts on their life. So these are the important thing for a person to have, symptoms for a person to have, to be classified as having hyperacusis. So what would be that diagnosis? So based on this definition, hyperacusis may be diagnosed if the patient's sound intolerance is related to the level of certain everyday sounds. The patient experiences significant distress as a result of their sound intolerance, and the sound intolerance significantly affects their day-to-day activities. So those things that there were in the definition, now we put them here as in the bullet points, that the patient needs to be feeling that the sounds are louder than normal, and that bothers them, that level of the sound, and they need to be distressed by their symptoms, and they need to, and their symptoms needs to impact on their life. So if all of these are not met, then the definition of hyperacusis, the diagnosis of hyperacusis may not be made. And then the fourth criteria was that the patient's sound intolerance is not better explained by something else. And for example, a hearing loss, so the person may have hearing loss, and the difficulties that they're experiencing because of the loud noises is in fact because they can't hear very well, or they may have post-traumatic stress disorder, or depression, social phobia, psychosis, so on and so forth. And so it is important that to exclude other conditions who can explain the disorder that the patient may, the problem that the patient may be experiencing. This doesn't mean that hyperacusis cannot be present in combination with other disorders. So in fact, hyperacusis is present in combination with many different disorders, including depression, post-traumatic stress, hearing loss, psychosis, all of those things that I mentioned, and many other things that I haven't mentioned, tinnitus, so on and so forth. But it is important to find out what is the source, main source of the distress that the person is experiencing. Is that because of the loud environmental noises? Is that because of hyperacusis, or the distress that they're experiencing is because of perhaps their underlying depression or post-traumatic stress disorder, or a combination of these? So that's an important topic to actually have in mind when you want to make a diagnosis for hyperacusis. Prevalence studies. So there is a recent study published in Laryngoscope, which is the Journal of the American Laryngological and Rhinological and Otological Society. And this was done by a multinational group of colleagues, mainly, but the study done in Australia. And so they assessed the prevalence of hyperacusis among individuals from the general population. The age range was between 45 and 70 years old peoples. And this was done by Smith and their colleagues. They reported that 15% of the participants were sensitive or intolerant to certain everyday sounds. And about 2% of them, their sensitivity to sound frequently or constantly affected their daily life, a marker for hyperacusis. So although 15% of the participants said they may have some sound tolerance issues, but not all of them, it was causing a distress or impacting on their life. And so the remaining 684 people who reported the sound sensitivity, it had no impact or only occasionally affected their daily life. Therefore, it is unlikely that they would be diagnosed as having hyperacusis if they examined by the doctor or their audiologist. Because you could be sensitive to sound and intolerate some sounds, but if it doesn't impact on your life or it doesn't cause distress, then diagnosis of hyperacusis cannot really be made. So based on this study, the hyperacusis, the clinical hyperacusis, that diagnosis, based on the definition that I explained in the previous slides, is about 2% of the population, at least in the study that was done in Australia. But in special populations, like clinical populations, audiology clinics, ENT clinics, then this probably is much higher prevalence of people with hyperacusis. For example, in my clinic, which is a tinnitus and hyperacusis center, so from people who had tinnitus, about 30% of them met the diagnosis criteria for hyperacusis. And in other studies that has been done in other centers, about 80% of people with severe tinnitus have hyperacusis. So in the tinnitus population, the prevalence of hyperacusis is much higher compared to the general population. And this is the classification that Professor Richard Tyler and his colleagues offered in their 2014 study. And they said that hyperacusis can have different subgroups: loudness hyperacusis, fear hyperacusis, pain hyperacusis, and annoyance hyperacusis. So which I will refer to these during this presentation, that if it is relevant to these categories. So what is the difference between hyperacusis and loudness recruitment? And so this always comes up. So loudness recruitment is the exaggeration of nonlinearity of loudness growth due to sensory neural hearing loss, wherein loudness grows rapidly at intensity levels just above thresholds, but may grow normally at high intensity levels. I give you Brian Moore in his Introduction to Psychology of Hearing gives a nice explanation about loudness recruitment, which I copied this from his book. So threshold, so imagine if a hearing threshold that's 4,000 hertz is 60 decibel in one ear and normal hearing in the other ear. So if a 4,000 hertz tone is instructed into his normal ear at 100 dB SPL, which would be about 100 dB above the threshold, then the tone, which sounds equally loud in the impaired ear, will also have a level about 100 decibel spiel. So thus, a tone which is only 40 decibel above the threshold in the impaired ear sound as loud as a tone which is 100 dB above the threshold in the normal ear. So you can see that. So that is the indication of of loudness recruitment. And I'll show you in my next slide to see how does this work. So for example, the hearing thresholds at the lower frequencies are normal. And then here they have, this person has hearing loss. And these are the uncomfortable loudness levels and thresholds at about 90 dB. And so as you can see, the dynamic range is much, much wider in the frequencies that there is no hearing loss, but that the frequency of the hearing loss dynamic range for hearing has significantly reduced, not because the uncomfortable loudness levels have got lower, but because the hearing thresholds are increased. But the scenario is different in people with hyperacusis. So the hyperacusis with the same sort of hearing loss or hearing thresholds, so the uncomfortable loudness levels would be reduced in a way that they go up in the audiogram. So again here also the dynamic range is reduced even in the areas with no hearing loss, but not from the top, if you like, from the bottom, from the ULL threshold. So you can see the difference here. Here you have the dynamic range reduced, and that's the indication of loudness recruitment. Here overall also the dynamic range is reduced, but mainly because of hyperacusis, because the ULLs are no longer in the normal level. They have reduced. Instead of being around the 90 decibels, they are about 70 decibels. We talked about the ULL, and in this presentation, I'll talk a lot about them. And so this is the uncomfortable loudness levels or loudness discomfort levels, so ULLs or LDLs. And the test for these is that, a patient put headphones on their ears and they are instructed to press a button as soon as the noises become uncomfortably loud. And and that would be the threshold for discomfort. So I'd like to share this study for you, which we done on 573 patients who were attending the tinnitus clinic in Guildford. And so the average age was 55 years, and 48% of the patients were male. So we measured the ULLs, and the number of patients who had a ULL of 60 dB or less at each frequency for the right and the left ears are shown in this table here. And as you can see, there are like a percentage of people at different frequencies, they have ULL of less than 60 dB. However, at 4 and 8 kilohertz, this percentage is the highest. For example, at 8 kilohertz, 13% of the people had a ULL of below 60 decibel, and that is reduced ULL because, normally ULLs are above 80 decibels for people who do not have any hearing loss or hyperacusis. And but if it is reduced to 60 decibel, that's a clear indication of reasonably severe hyperacusis. We get to more severe than this as well, but this is already quite severe form of hyperacusis. The studies that we've done in terms of the what would be the criteria for people in terms of the ULL, like what is the threshold of the ULL that we can say below that is an indication of hyperacusis, is the average ULL in the worst ear, which would be the ear with lower level of ULLs, of 77 decibel or lower. That's an indication of hyperacusis. That shows that ULLs are abnormally reduced. But in this particular analysis, we are demonstrating the number of people, the percentage of people who actually had the ULL of 60 dB or less. Now, factors which were related to ULL min. ULL min is the average ULL across frequencies in the ear with the worst ULL, which means with the lowest ULLs. So this is called ULL min. And so there were significant correlations between ULL mean and a score for the pure tone average for the ear with the better hearing, with the Hyperacusis questionnaire score, this is HQ, Hyperacusis Hyperacusis questionnaire, the anxiety subscales of Hospital Anxiety and Depression Scale, HADS, the depression subscale of the Hospital Anxiety and Depression Scale, tinnitus handicap inventory, also significant correlation, insomnia severity index, also a significant correlation, and age. But there was no significant correlation between ULL mean and the loudness of tinnitus, because this was a tinnitus population. So what we did, we put all of these factors which were significantly correlated with ULL mean into a regression model and to see which one actually remained as significantly predicting the values of the ULLs. And the variables which were significantly correlated were included. 5 variables did not significantly increase the proportion of variance predicted by the regression model. And these the variables which did not influence on the values of the ULL mean were depression score, hearing levels, tinnitus handicap inventory, anxiety, and insomnia scores. These were excluded from the model because they were not really predicting ULL mean. And this is the final model. What was predicting the ULL mean was the score on the Hyperacusis questionnaire and age. So these were the 2 variables which were predicting the ULL mean. And it makes sense because Hyperacusis score, the higher Hyperacusis score, the worse or the lower ULL min. Now, another important factor when you look at people with severe hyperacusis or hyperacusis general is between ear differences in average ULLs. Most of the patients had similar across frequency average ULLs for the 2 ears. However, 40 patients out of 486 patients, so about 8% of the population, clinical population that we studied, had a between ear difference of 10 dB or more. So that means that the ULL average in one ear was 10 dB or more different from the average of the ULL in the other ear. So in 8% of the patients in the rest of the population, there were not really, there were the difference between them were less than 10 dB, but in only 8% of them, the difference between the ULL in 2 years were more than 10 dB or more. And the question is why? Is there any differences between the characteristics of these patients who have interaural asymmetry, if you like, in ULL values? There is a between ear difference in ULL values compared to those who do not have this particular feature. So the mean between ear difference, so the first thing that comes to mind is to see if the hearing loss, is it the hearing loss that is the reason for the differences in the ULLs? Obviously, if the hearing thresholds are lower and if the person has hearing loss, that can automatically impact on the ULL and push the ULLs a bit further down compared to people who have a better hearing. So first thing, we had to factor for that hearing loss. The mean between ear difference in pure tone average for these patients was about 12 decibel, which was significantly higher than the mean for the remainder of the population, which was about 5.4 decibels. So people who had between ear difference in ULLs, they also had a bigger between ear difference in the hearing thresholds. However, among the patients with a between ear ULL difference of 10 dB or more, 55% of them had a between ear difference in the PTA less than 5 dB. So the difference between the ULLs could not have been explained entirely because of the differences in their hearing thresholds. So for patients with between ear difference in ULL of 10 dB or more, the mean score on HQ, Hyperacusis questionnaire, was 20 dB, 22, and this was significantly higher or worse than the mean HQ of 17.6 for the remainder of the population. Therefore, a large interaural asymmetry in ULLs is associated with a higher hyperacusis impact, which is measured by a hyperacusis questionnaire. So those whose ULLs were kind of imbalanced, they had more hyperacusis impact compared to those who perhaps the ULL were reduced equally in both ears. There are no significant difference in anxiety and depression scores as measured by HADS, which would be Hospital Anxiety and Depression Scale, between patients with interaural asymmetry in ULL of 10 or more or less than 10. And so this could not be explained by anxiety and depression symptoms. But the hyperacusis handicap was more pronounced in those with bigger asymmetry. So for 6 patients, the interaural asymmetry in ULLs was over 20 decibels. So this is very significant, 20 decibel difference between ULL values in one ear and the other ear. And the largest value was 27 decibels. So it's quite a big gap. And, you know, if you look at the literature, there are very little information about the between ear differences in ULLs. In fact, many of the researchers believe, and clinicians, that hyperacusis is a bilateral condition. But as you can see in the data that it presented, there are, yes, a majority of the people, there is very little difference between the ears, but there are a percentage of population of patients with hyperacusis that there is a significant between ear difference in the ULLs, which cannot be explained by the differences in their hearing thresholds. For these patients, the mean difference in PTA was 4.8 with a minimum of 2 dB and a maximum of 11 dB. And so majority of the patients had an across ear difference in PTA less than 6 dB. Therefore, it seems that the most cases of large interaural asymmetry in ULLs cannot be explained by interaural differences in pure tone hearing thresholds. So now, what are the implications for research? A large between ear difference in ULLs might indicate some specific abnormality in monaural pathways. Further studies of people with large between ear differences in ULL could give some insights, some clues to whether the intolerance to sound is mainly due to increased loudness perception in the ear with lower ULL, which could be studied by comparing the loudness of sound presented alternately into the 2 ears to a dislike of a specific sound when presented to that ear, or to a dislike of a class of sounds with certain spectral characteristics. So it is of great interest of studying people who have between ear difference in the ULLs and find out what are the differences in lots of different factors, including the imaging studies or other biological factors between these people with large asymmetry in the ULLs and those whose ULLs are reduced, but equally in both ears. So this is an important research question, which MSc students, PhD students, or researchers, if you're listening, so this could be something for you to further study. Now, what are the implications for clinical practice? So if a global psychological or neurological component is predominant in producing hyperacusis, then it seems unlikely that it would affect one ear more than the other. Consistent with this, most of our patients and those in the studies reviewed with the previous studies, the ULLs are almost equal. However, our results showed no significant difference in anxiety, depression scores as measured by HADS between patients with between-ear differences in ULL of 10 or more, and those with differences less than 10 or more. So what these studies in terms of the next part of the presentation tell us is that those who had bigger difference in the ULL average between years, they actually had more significant hyperacusis impact. And now the title of this presentation is about severe hyperacusis. So we followed this research up, and we wanted to see who are the people who have the most severe form of hyperacusis and what are the characteristics within that population. We already had a clue that a large interaural asymmetry in terms of the ULL values could be a difference between those with severe hyperacusis and those with less severe form of hyperacusis. In the next study, we looked for that. So the people with severe hyperacusis is very much consistent with the categorization of Professor Tyler of pain hyperacusis. So pain hyperacusis is characterized by experiencing pain at lower sound levels than listeners with no hyperacusis word. And this is their definition. And several authors reported in cases of severe hyperacusis, ULLs can be as low as 30 decibels. Therefore, it is not surprising that for patients with ULLs close to 30 decibels, a wide range of day-to-day environmental sound might be perceived as uncomfortably loud or painful. And this is what we called severe hyperacusis. And the next study is about that, which we wanted to see what is the prevalence of severe hyperacusis in a clinical population of patients with tinnitus. So the criterion for severe hyperacusis was taken as the ULL of 30 decibel or less for at least one frequency of the measured frequencies for at least 1 ear. So that was, so if they had a ULL at a single frequency, that's the minimum, one frequency of less than, of 30 dB or less, we classified that person as having severe hyperacusis. And then we made a comparison between the characteristics of this group of patients with severe hyperacusis and the remainder of the population. So 13 out of 362 patients were diagnosed as having severe hyperacusis based on a ULL of 30 dB or less for at least 1 ear and 1 frequency. So about 4% of the clinical population who were seeking help for the tinnitus, they also had severe hyperacusis. And the mean age was about 40 years old, and they were 16 years younger than the remainder of the population, and that was a significant difference. So this table here tries to give you the some of the questionnaires data, a comparison between the people who had severe hyperacusis compared to the remainder of the population, which all of these were tinnitus patients who were seen in the clinics, and some of them had severe hyperacusis based on this criteria. So we grouped them in one group and compared everything between these two groups. We used the questionnaire tinnitus handicap inventory, visual analog scale of tinnitus loudness, hyperacusis questionnaire, HADS anxiety, HADS depression, and insomnia severity index. So you see the mean levels for the group population that did not have severe hyperacusis. They might have hyperacusis, but not severe. And the mean values for those with severe hyperacusis. None of the questionnaires were significantly different except from hyperacusis questionnaire. So the group with severe hyperacusis, which is a criterion based on ULLs, not by the patient report, not by a questionnaire or anything. This was a criterion used entirely based on the ULLs. So they had significantly higher impact of hyperacusis as well. So that shows this consistency between ULL values and this particular criterion and the scores on a standardized hyperacusis measure. Now, this table here goes list these people who had these 13 patients who were diagnosed with severe hyperacusis and gives details about the different factors within them. For example, the hearing loss categories, majority of them had normal hearing or a mild hearing loss. And this is the right ear and the left ear. Now here we reported the interaural difference in PTA, so the difference between hearing thresholds in the two ears. And this is the difference that you can see ranged from 1 decibel to 16 decibels, but majority of them it being 3 to 4 decibels different between ears in the pure tone hearing thresholds. Now, the mean ULL and the lowest ULL. So here we are going through that direction to see, is there any variation in the ULL threshold at each ear or between ears, the sort of hints that we got from the previous study. We're looking for those things in this population of people with severe hyperacusis. We want to see, are the ULLs kind of flat ULL thresholds, or there are variations. There are some frequencies ULLs worse than the other frequencies. And then we want to see also between the ears, are the ULLs among people with severe hyperacusis equally lowered, or there are again extreme interaural asymmetry in the ULL values among people with severe hyperacusis. So here is the data that we reported. So the first number is reported as the mean of the ULLs in the right ear, and here the first number is the mean of the ULL in the left ear, and the second number is the lowest ULL value in that ear. So for example, in the right ear for this particular patient, 28 dB was the mean and the lowest was 20. Here 55 was the mean, the lowest was 30. And so 30 here. As you can see, the sum of them, there is some hints that there may be a lot of variations in the ULLs. For example, this person, the mean of the ULL, the average of the ULL in the right ear was 53 dB, but the lowest ULL was 10 dB. So they must have had variations in ULLs across the frequency range. Similar trends were happening in the left ear. So because people with severe hyperacusis were only 4% of the population, so future studies really need to look into this. Again, MSc students, PhD students, researchers, if you want to study hyperacusis, so in the larger population, look for severe hyperacusis and try to find out these variations of ULLs in each ear and the differences between the two ears. This can give us some clues about the characteristics of hyperacusis and the underlying mechanism for it. Now, the interaural difference in mean ULL, so this is the differences between the two ears, are listed here. So some of them are 12 dB, 7, 3, and this one, for example, this patient, no difference in their ULL between the ears. Now, in the next columns, we list number of frequencies with ULL of below 30 dB. So even if they had one threshold, one frequency of ULL of below 30 dB, they were classified as having severe hyperacusis. But in this columns here, we are listing which frequencies and how many frequencies they had below or 30 dB ULL values. For example, the right ear in this particular patient, so it was 5 frequencies they had. This patient, 1 frequency in the right ear, and that was 8K. This person had no frequency in the right ear, but they had 8K in the left ear, which was below 30 dB. So here is all of these are listed, that which frequencies and how many frequencies were the ULLs 30 dB or less. And this is the range of the ULL values. So basically is the difference between the highest ULL and the lowest ULL at each ear. And so, for example, in the right ear for this patient, the range was 15 decibel. So this is 8 kilohertz, was 15 decibel lower in terms of the ULL than 500 hertz. Or this one, 40 decibel, the range of the ULLs, the across frequency variations of the ULL was 40 decibel in the right ear. So, and again, this is a difference between 8 and 3K. So that means 8K was 40 decibel lower than the 3K. So very significant variations in the ULLs within each ear was very pronounced among people with severe type of hyperacusis. So this is another thing that future research needs to look into it. And then we also looked at the general characteristics of people with severe hyperacusis. Here I listed the age range for you. We have like between 12 to 50, 71 years old, male and female. These hyperacusis scores were quite high, majority of them. Majority of them had some sort of an otological history, Bell's palsy, tinnitus, ear infections, ear pain, so on and so forth. And also some sort of a significant mental health history, majority anxiety or depression. And the medical history that we took from them, many of them are taking antidepressants or taking medication for other disorders as well. So conclusions. Patients with these patients mostly had normal hearing thresholds or mild hearing loss, and they mostly had similar ULLs across the ears, but strong across frequency variations in ULL, suggesting hypersensitivity to specific sounds. Often high frequency sounds was present. The most common frequency for which the ULL was 30 dB or less was 8 kilohertz. The patients with severe hyperacusis has a grand mean ULL of 47.5 decibel and were younger and exhibited more hyperacusis handicap than the remainder of the sample. There was a high incidence of otological abnormalities and mental health problems among patients with severe hyperacusis. Therefore, a combined audiological, otological, and psychological evaluations are recommended in the assessment of patients suffering from severe hyperacusis. Yes, thank you very much for listening to this presentation. I hope that I didn't go over time. And this is the final slide, my website of the tinnitus masterclass, which I teach, specialized rehabilitation program for tinnitus, hyperacusis, and misophonia management. If you would be interested, the website address is here. And so thank you very much for listening.